Okay. Are you ready? Picture a young girl, 5 years old and struggling in kindergarten. She is happy, friendly, and loves to play, but she hates school. Every parent-teacher conference is one more time for her mother to hear how she doesn't follow directions, she cannot stay on task, and she is always in some other world. This little girl's desk has been moved directly next to her teacher's, and an inbox is placed on her desk. Work that does not get completed on time is placed in the inbox, and at the end of the day, she brings home the work. Her parents try a reward system at home. They are in constant communication with her teacher, and by the end of the school year, their daughter is academically behind. After a year of struggle and frustration, they make an appointment to speak with the pediatrician. After tests and forms and some evaluation, this then little 6-year-old was diagnosed with ADHD. Hello, my name is Cheryl Broderson, and this little girl is my daughter. I am here to talk to you about what ADHD is and why it is important to recognize it and get it diagnosed early. ADHD stands for Attention Deficit Hyperactivity Disorder. Many people, and I was one of them, hear ADHD and think of a child bouncing off the walls, running around out of control. Mainly the hyperactive side of the disorder is what comes to people's minds. According to the CDC, ADHD is a neurobehavioral disorder that is one of the most common disorders of childhood. Many scientists have come to believe that ADHD is a result of chemical imbalances in the brain. This is how our daughter's pediatrician explained ADHD to us and to our daughter. ADHD has 3 subtypes. The 3 subtypes are ADHD, primarily inattentive type, ADHD, the primarily hyperactive, impulsive type, and ADHD combined type. My daughter is the combined type, as are most children diagnosed with ADHD. The most common signs and symptoms of ADHD are difficulty listening, daydreaming, being easily distracted, forgetting things, talking a lot, being fidgety or in constant motion, interrupting others, having trouble taking turns, and speaking without thinking first. Scientists are unsure about what causes ADHD, but they do know that genetics seems to play the largest role. For those who are diagnosed with ADHD that do not seem to have a familial history of mental disorders, scientists turn to the environment. They have come to the conclusion that there is an increased risk for ADHD if the mother used tobacco or alcohol during pregnancy, there was a traumatic head injury, or exposure to high levels of lead. Contrary to popular belief, ADHD is not caused by bad parenting or a diet high in sugar. ADHD is a lifelong condition and can be associated with other mental disorders, such as depression, anxiety, etc. The diagnosis of ADHD is not a simple one. Due to the fact that all children go through phases of having trouble listening, not staying on task, not doing what they're told, ADHD is not taken lightly. Parents may notice symptoms in their child at home that seem extreme for their age. And what I mean by that is most other children at a certain age have learned to follow directions in the school setting. When a teacher tells them to put their pencils down, put their papers in a certain location, and line up to get ready for lunch, most children will get up and do that. Children with ADHD may seem like they're just sitting there daydreaming, or they will put their pencil down and get distracted by something. End result is they don't end up in line where they should be. They often get off task and get distracted. Teachers may notice behaviors at school that may suggest that a child may have ADHD, but it all comes down to the medical professional to make the official diagnosis. To diagnose a child with ADHD, parents are interviewed about their child's behavior at home, what they notice in the everyday life, at bedtime, in the morning, before school, after school, during the day, on the weekends. And then teachers are also interviewed about what goes on at school academically. If the child has time has trouble staying on task or has a hard time listening, they're often seen daydreaming or getting lost. My daughter in kindergarten would go to the restroom and wash her hands, and eventually the teacher would say, "Oh, I wonder where, Michaela is." And she would walk into the bathroom, and Michaela would have a sink full of bubbles, just overflowing, and she was just sitting there playing with bubbles like nothing was wrong. These children get distracted by just the simple things in their environment. Finally, after gathering information from both parents and teachers, physicians or a mental professional, such as a psychiatrist or a therapist, will evaluate the child. They look over the information that the parents and the teachers have submitted, and then they will evaluate the child, observe the child, and answer some questions for themselves, and then a diagnosis is finally given. Once the diagnosis of ADHD has been made, it's time to discuss treatments. There are two major options for treatments: behavioral therapy and medications. The best treatment possible for children with ADHD is to combine the two. Do behavioral therapy plus medication. My daughter is on a medication, and the medications that are most commonly used are called psychostimulants. Even though they are stimulants, they have a reverse effect on people with ADHD. So instead of increasing the hyperactivity, it actually calms them down. Some examples of psychostimulants are Ritalin, Concerta, Daytrana, Adderall, and Focalin. Behavior therapy includes talk therapy, in which the parents and the child and any other family members will talk with a professional about ADHD and what they can do to support the child in school plus out of school. At home, parents can use a system of rewards and consequences, which is something that we do, along with giving their child a structured routine. Limiting distractions in the environment, as well as keeping in constant communication with the child's teacher, are also good ideas. Here are a few facts regarding ADHD. ADHD affects 3 to 5% of all school-age children. It is more commonly diagnosed in boys than girls. As I said before, it's a lifelong disorder, but just because a person is on medication for ADHD does not mean that they will continue on it through adulthood. Many times children get to an age where they are able to develop strategies for managing their ADHD, and at some point may be able to go off the medication. Imaging studies have shown that the brains of children with ADHD are different than those of other children, and it is recommended that children with ADHD be diagnosed and given a treatment plan as early as possible, because this disorder can affect their academics, their school life as far as developing friendships with other students. It affects their family life. It affects, like I said, the social aspect of life, but also being able later in life to build long-lasting relationships, and as an adult it can affect their career. ADHD has become an increasingly common diagnosis. Symptoms of this disorder are lack of attention span, hyperactivity, and inability to focus and stay on task. Children with ADHD are diagnosed only after going through a process of interviews and evaluations, and there are suitable treatments for the disorder. Whether a parent chooses a medication for their child or behavioral therapy, no single treatment is best for every child. Parents need to stay involved and work to help their child succeed. My daughter was diagnosed with ADHD when she was 6 years old. She will be 8 this summer, and she went from being a struggling student to being in the top of her class in math and reading. She is happy, has lots of friends, healthy, and she is still one of the most amazing children I know. I have some ADHD fact sheets here for you each to take, along with a copy of my references that I used for my information. Thank you for coming.